we are the ones that are paying for that fraud. I'm going to offer you some tips on how you can prevent fraud and abuse, and there's a difference between the two, and explain how to report it if you suspect that you are a victim of fraud or abuse, where you can report it to. And then I'm going to introduce you to the Senior Medicare Patrol, which I am a part of. Now, you need to remember I'm a volunteer, so that means I'm not paid and I'm not an expert. You might have questions that I'm not going to be able to answer, and if I can't answer them, I'll just tell you I don't know the answer, but I'll be able to give you resources to the people who will be able to answer, because we have special benefit specialists and people who are actually trained much more than I am to help people resolve problems. The clicker isn't working. Okay, what is Medicare? Well, all of us probably are on Medicare, except my wife. It's a health insurance program. A lot of people don't realize it's actually an insurance program. It's designed in general to benefit individuals who are age 65 and older and certain other qualified individuals. I am not 65 yet, I'm 64, but I've been on Medicare for 4 years now because of disability with some health issues. So I'm very concerned with the Medicare. And it's comprised of 4 main parts that you've heard about. Part A, B, C, which is the Medicare Advantage plan, which we'll talk a little bit about later, and then Part D, the prescription plan. Medicare is administered, it's under the control of the Centers for Medicare and Medicaid Services, a division of the Human Health and Human Services in Washington. Part A, of course, is that part that helps us when we are actually into hospitals or skilled nursing care. Part B is your doctors and outpatient care. And then Part D is the prescription drug plan that came out about 2 years ago. Now you notice I didn't mention Part C because that is something totally different. It isn't really a direct part of Medicare. Now what is the fraud that you hear about? This is what the law says. Under the False Claims Act, it's a federal law, it is a criminal offense to present a false or fraudulent claim for medical services if the individual knew that the claim was false or fraudulent. And the key word there is the person has to know what they are doing is illegal before it can be considered fraud. Now, doctors and billing companies make mistakes, honest mistakes. That is not fraud. Abuse is something a little bit different that we'll get into. But the fraud is the part that really is what's costing us money. Here are some national Medicare facts. Right now, and these are maybe a couple years old, these facts, 44 million seniors are disabled Americans are currently enrolled. 44 million seniors and disabled Americans are enrolled in Medicare. Growth in the net Medicare spending is expected to increase 7% over the next 5 years. Even greater increases in spending over the next 10 years as baby boomers start to mature. My wife and I are the baby boomers, and we are the ones that are entering the Medicare system now by the millions. And under the Obama plan now, more younger people are going to be entering into it. Another thing I should point out, I'm not here to debate the good and the bad of Medicare. You know, we could go on and on and on and on. I have some issues myself, but my main role and primary role is to help you not become a victim of fraud. What's the cost to the public health care system? Now 1%, now it doesn't sound like very much, 1% of the providers bill 10% of Medicare or Medicaid payments. So that means 10% of all the money of the fraud was a result of only 1% of the people doing it. In 2004, Medicare lost alone $19 billion to error, fraud, and abuse. And that number is going up every year. And the money that's spent out is expected to outpace assets by the year 2013. So in other words, by the year 2013, Medicare is going to spend much more than it takes in.